This podcast is narrated by an AI-generated version of Ravi Tawani's voice. Canine Diabetes, Current and Emerging Therapies. Introduction. Conventional therapies for canine diabetes. Insulin therapy injections. Exogenous insulin is the cornerstone of managing canine diabetes, especially for the typical type 1 cases that require lifelong insulin therapy. Insulin injections help lower blood glucose in dogs who cannot produce enough insulin on their own. Traditionally, veterinarians use intermediate-acting insulins such as neutral protamine Hagedorn NPH or Lent insulin veterinary porcine insulin zinc suspension, sold as Vetselinkin insulin given twice daily. New insulin formulations and delivery devices are improving convenience and control. For example, protamine zinc recombinant human insulin Pfizer brand Prozinc was recently approved for dogs and often provides a longer duration of action 18-24 hours. This allows many diabetic dogs to be well managed with once-daily injections, reducing the burden on pet owners. In addition, specialized insulin pens like the VetPen enable precise, easy dosing with multi-dose cartridges, minimizing injection pain and user error. Ultra-long-acting insulins are also under study. A concentrated insulin glargine U300 formulation showed promise as a once-daily option in diabetic dogs. Overall, modern insulin therapies combined with owner education on proper handling and injection technique remain the first-line and most effective treatment for canine diabetes. Dietary management. Nutritional therapy is a crucial component of diabetes care in dogs. A consistent feeding schedule synchronized with insulin injections is important to maintain steady glucose levels. Most diabetic dogs are fed twice daily at the time of their insulin dose to prevent post-shot hypoglycemia. Diet composition can significantly affect glycemic control. Veterinarians often recommend diets high in complex carbohydrates and fiber, with controlled fat content. High-fiber diets slow glucose absorption and blunt post-meal blood sugar spikes, leading to smoother glucose curves. Prescription diabetic dog foods incorporate such fiber blends and also limit simple sugars that could trigger rapid glycemic swings. Weight management and body condition are also emphasized. Many diabetic dogs are overweight, which worsens insulin resistance, so a controlled calorie diet to achieve a lean body condition can improve insulin sensitivity. Conversely, underweight diabetic dogs may need a higher protein, moderate fat diet to restore body mass while still controlling carbs. Advances in glucose monitoring. Monitoring blood glucose levels is vital to adjust insulin dosing and avoid dangerous highs or lows. Traditional monitoring in dogs involves periodic blood glucose curves, multiple blood samples over the day, or checking spot glucose and fructosamino lab test reflecting average glucose over 2-3 weeks. While effective, frequent blood draws can be stressful for dogs and inconvenient for owners. Recent advances have introduced continuous glucose monitoring CGM technology to veterinary care, greatly improving insight into diabetic pets' glucose trends. Devices like the Freestyle Libre, originally developed for humans, are used off-label in dogs, and pet-specific CGM systems are emerging. A tiny filament sensor is placed just under the dog's skin, often on the back of the neck or shoulder, held in place with adhesive. This sensor measures interstitial glucose every few minutes and stores the data. Owners or veterinarians can then scan the sensor with a reader or smartphone to get real-time glucose readings and trends. The CGM provides a wealth of information. It reveals daily patterns, post-meal spikes, overnight drops, and the duration of insulin's effect, which are difficult to fully capture with a once-a-month glucose curve. Using a CGM can thus reduce the frequency of needle sticks and clinic visits, lowering stress for diabetic dogs. It also helps catch asymptomatic hypoglycemia or hyperglycemia early, since the owner gets alerted to abnormal readings at home. Experimental and emerging treatments. Gene therapy. One of the most exciting research frontiers is gene therapy aimed at a long-lasting cure for diabetes. Instead of giving insulin injections for life, the goal is to reprogram the dog's own cells to produce insulin. A pioneering approach by researchers in Spain demonstrated that a single session of gene therapy could effectively cure diabetes in dogs. In this method, harmless adeno-associated viral A vectors carrying two genes, one for insulin and one for glucokinase, an enzyme acting as a glucose sensor, are injected into the dog's leg muscles. Muscle tissue then begins producing insulin, and the co-expressed glucokinase helps the muscle cells sense blood glucose and secrete insulin in a regulated way. In diabetic dogs treated with this gene therapy, blood sugar normalized without any external insulin, essentially creating an internal insulin pump in their muscle. Remarkably, a single treatment kept the dogs normoglycemic and insulin independent for years, over 4 years in some cases, with no recurrence of diabetes signs. Cell-based therapies and regenerative medicine. Instead of altering existing cells with genes, another strategy is to replace or regenerate the insulin-producing cells themselves. Islet cell transplantation, transferring healthy insulin-producing pancreatic islet cells into a diabetic patient, has been successfully done in human medicine. In dogs, islet transplants are not routine due to barriers like limited donor tissue and the need for immunosuppressive drugs to prevent rejection. Another novel cell therapy under investigation is the use of neo-islets clusters composed of donor islet cells combined with mesenchymal stem cells. A pilot study treated diabetic pet dogs with allogeneic donor-derived neo-islet aggregates, resulting in up to a 50% reduction in their daily insulin requirements, with significantly improved blood glucose profiles, all without immunosuppressive drugs. Immunotherapy approaches. Potential approaches include immune tolerance induction, for example, giving oral insulin or pancreatic antigens to induce regulatory immune cells, vaccines that shift the immune response away from attacking islets, or monoclonal antibodies that target T cells or inflammatory cytokines involved in any autoimmune process. Conclusion. While standard insulin injections and diet remain the foundation of care in the immediate future, pet owners and veterinarians can be encouraged by the advances on the horizon. The ultimate goal is to ensure diabetic dogs live long, healthy, and happy lives with treatments that are ever more effective and easier to manage.